There's this term out there called sexual anorexia. It was developed by a doctor named Weiss. He suggests that low sexual desire or no sexual desire is actually a form of withholding, that actually the person does feel desire but withholds it intentionally. His whole premise is that this is intentional, that the person that has low sexual desire or no sexual desire is actually doing it on purpose, and purpose in either to get something or to punish the other person. Nothing could be further from the truth. From my experience, that is not what happens. And it's problematic to present it as this intentional thing, because first it's very divisive. It's like already you're having issues with having sex with your partner, and a lot of times that's because there's relational conflict. So what, are you going to just now divide them even more and catalog one person as the identified patient, as the person that has the problem, as the person that needs to fix something? He pathologizes the individual. He sees this as an individual issue, not as a relational issue. And so what happens is when it's seen as an individual issue, first of all, it's not effective because most of the time it's a relational issue. And second, it places the responsibility and shame for the issue on the person. And a lot of times shame is an integral component of not having a lot of sexual desire. So you're going to dump more shame on it. It just does not make sense. It does not work. It is the antithesis of what we should do when people are experiencing low or no sexual desire. Most of the time, these women are overworked, overtired, overstressed, because in fact, it is still this way to this day. They perform 75% of the household chores. And not only that, they're also managers. They're the ones that have to manage the whole thing. Not only do it, but also manage it. And so going at it like, okay, person, you're the problem and you're the one that has to go and fix this, it's so ineffective. I don't even know. This guy is absolutely insane. And to think that he's made so much money with this coined term. And by the way, there are other terms that we should use for this. There's low sexual desire, there's no sexual desire, there's asexuality, there's hypoactive sexual desire. These are all terms that we use regularly as therapists or sex therapists. But now this addition, this sexual anorexia really, takes it to a completely crazy level. And then guess who gets a free pass in all of this? Like if the person that has a higher desire is being, God forbid, abusive at the worst end of things, or at the most benign things, like kind of like not really into anything, sitting on the couch, not really willing to engage in the household chores, not very exciting. So where's the responsibility for that other person when the identified patient is feeling low sexual desire? No, that person doesn't have to change any of that. Like they don't have to change their abusive or misogynistic behaviors because that's fine. That's not causing any issues. So it gives the perpetrator sometimes a free pass, which is nuts. And then, to compare it to anorexia nervosa, that is like, it's taking, yes, sexual difficulties in a relationship are devastating sometimes, and they may lead to the end of a relationship. But they're not going to kill us. They're not going to make us, it's not lethal. Anorexia nervosa is lethal, and to have the balls to call it that is, again, like really upping the ante and upping the division of these two people that are already divided and already feeling all kinds of negative feelings, and now you're going to add this to it. Plus, anorexia nervosa is about control. It's about feeling shame, and how you perceive your body and what you do to your body are ways to control the world around you and control your inner world. That's not the case with a lot of low or no sexual desire. It's not about control. It's not about shame. Some of it does have to do with shame with your body will lead you to have lower sexual drive. But shame with your body, probably 90% of women feel that. That doesn't mean they have anorexia. And it kind of devalues the severity of anorexia nervosa and raises the importance of this issue, which is important, but not to the level of I'm going to die here. And actually part of the treatment is knowing that whatever's happening in the relationship is not going to kill you. Also, what if the low sexual desire or the no sexual desire is due to trauma? Whether it's trauma in the relationship, maybe there was infidelity, or maybe there was some sort of betrayal, or some sort of emotional abuse or physical abuse, or there's trauma that comes from them from another place that's not in the relationship, that's previous to that, maybe some childhood trauma. Trauma affects our sexuality and our sexual desire. When you say this is intentional, you take trauma out of the picture, because trauma is not intentional. It's something that happened to us, and we have reactions to it, and a lot of times reactions that we can't control. When you say low sexual desire or no sexual desire is a withholding, intentional withholding, trauma's out of the picture. Trauma can't be part of that, because trauma is definitely not intentional. This term anorexia nervosa drives me nuts. I think it's a crock of bullshit.